Welcome back, everybody, to the Now Morning Show here on TTT. Remember, we are also live on Talk City 91.1 FM and on Facebook at TTT Live Online. So we were talking about back to school in a short while, in about a couple of weeks. So let's find out what the North Central Regional Health Authority is doing. Dr. Rabia Haidal Mohammed of the Pediatric Emergency Department is here, and we are going to talk about the Back to School Child Wellness Initiative. Good morning and welcome, Doctor.
Good morning. Thank you for having us here today.
It is a pleasure having you because I want to find out more about this Child Wellness Initiative. What is this all about?
Well, I was really happy to hear you all speaking about it back to school today, because it really is timely that the North Central Regional Health Authority on Saturday, the 24th of August, 2019, from the hours of 9 a.m. to 2 p.m., we will be having our first ever, a very unique child wellness initiative. It will be held at the Mount Hope Women's Hospital, the Women's Center, and we expect the age group between 5 to 16 years of age, because that's really our back to school sort of population. We realize that, you know, before the age of 5, there are a lot of encounters with the healthcare system through vaccination, routine schedules. However, that age group, when they start school, there's less need for the follow-up, because any issues neurologically, cardiovascular, with the heart, things like that would have been picked up because of those regular visits before. However, we really at the North Central think that children between these ages, we do not want to miss any sort of underlying illness or disease, and we as well would like to involve them in more screening and more healthy habits. So we do have a sort of health and wellness part of it. In terms of the health, we have doctor checkups that will be available for the children and parents to access. So definitely the parents must walk with their own national ID card and the child's birth certificate for registration. And doctors will be on site to provide any advice, any checkups, any issues. If your child, though, is seriously ill in terms of having a temperature of more than 37.5 degrees for more than 3 days, they are not breathing properly, they are very lethargic and not responding well, please do not bring them to the Child Wellness Initiative. Carry them to your nearest emergency department for treatment so that that can be started immediately. The Wellness Initiative is really also to encourage vision and hearing screening. It is usually done by the primary care team upon school entry, but again, we're fostering a sense of awareness and empowerment of the parent and the child, so that even these little things of problems with vision and hearing can affect learning can cause problems with learning, and those are very correctable things, so we don't want to start the child at a disadvantage. We will also be having dental assessments to advise on caries and dental caries and eating too many sweets.
How are you going to convince young people, children, not to eat too many sweets?
So it is about a lot of parental education. So if you actually do not have the soft drink or the juices, which can be just as dangerous, because sometimes we think that, oh, it's juice, but really if you look at the content of the sugar, it's quite high. So we will be having body mass index assessments, which sort of tell you whether you're appropriate for age in terms of your weight and your height. And dietitian and nutrition will be on site as well for that sort of counseling, and to pick up if there's anyone who is overweight for age and put them and refer them onwards for more counseling, because we really do have a population who we would like to prevent becoming more obese. So if we start right now at the level of prevention, talking, and really educating the public, we hope to have a healthier population.
And you mentioned 5 to 16 years. So you're targeting just people going back to school. But, you know, with the influx, and this is a conversation that we've been having a lot in Trinidad and Tobago, say from Venezuela, the people who came in, are they allowed to come, or is it just for Trinidad and Tobago nationals only?
So you definitely have to walk with the child's birth certificate, and you have to walk with the parental ID. Emergency treatment is not prevented or disallowed for any non-national. If a child is ill, they definitely can access the emergency department. Immunizations, will also be offered at this initiative.
Right.
And immunizations for children are very important, because if it is that we have a population who does not have vaccines, then by a process we may actually end up with communicable diseases. So please walk with your child's immunization card as well.
Where can people go to get more information on this initiative?
There is the North Central Regional Health Authority Facebook page, and so they can access that to get more information. But it's basically a walk-in, it's free, and walk with your immunization card, parent ID, birth certificate. There will be a lot more fun activities as well. In order to endorse, there will be reading as well as interactive displays on the dangers of tobacco smoking, vaping, and e-cigarettes.
All right, so a lot to look forward to. It takes place on Saturday, 24th August, 9 a.m. to 2 p.m., the Mount Hope Women's Hospital. Thank you very much, Dr. Rabia Haidal Mohammed of the Pediatric Emergency Department, NCRHE, for joining us this morning, telling us about this initiative. Thank you once again for joining us.